5:30 business meeting. Some of you were with us earlier for our work session on the Housing and Homelessness Strategic Plan update. So thank you for being here for that. To walk you through a little bit of our meeting, we have a fairly short agenda this evening. We have 3 items on our consent agenda, and then we will have time for general public comment. First, we'll call on people that are in person, then we'll call on people who are online. We'll ask you to sign in with your name and Douglas County address, and also state that for the record for your 3 minutes. So all comments are limited to 3 minutes. We ask that everyone give their full name, Douglas County residents. All public comments should be directed to the County Commission. We reserve the right to mute anyone who is vulgar, rude, or inappropriate. Campaigning for public office is not allowed. The public should know that the comments received by the Commission during our meetings do not represent the views of the Douglas County government. We're glad to have you here. And I would also note that Commissioner Patrick Kelly is joining us online tonight. So with that, we move to our consent agenda. Do I have any commissioners who would like to pull an item from the consent agenda for further discussion? No. Do I have anyone from the audience who would like to pull an item from our consent agenda? Or anyone online? Okay, with that, I would entertain a motion to approve.
Commissioner Reed, I move to approve consent agenda items. I think it's 2.1 through 2.3. All right, I don't have the paper in front of me. Oh, sorry, thank you. 1.1 to 1.3. Sorry about that, Commissioner Willie.
Thank you. Do I have a second?
This is Commissioner Kelly, second.
Okay, all in favor, say aye.
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 Consent agenda passes. And we move on to general public comment because we have no regular agenda items on tonight's meeting. I assume most of you are here for general public comment. So whoever would like to be first, if you would step up and give us 3 minutes.
Hear me now? Yeah. Hello, everyone. So I watched the work group meeting and I wanted to come in and clarify a few things. Not going to harp on clerical stuff, but page 7, the substatement to the heading, I really couldn't understand that. To reduce disparities and optimize equity, the following low income populations will be focus of some efforts due to the presence of known disparities, ? I'm really not sure what that meant. The one I am a little frustrated with is the one that we skipped by pretty quickly. As I was watching, the screen rolled down past this page real quickly, and it was the one talking about using trauma-informed holistic approach. And I didn't hear a lot of talk about that in the meeting. Comprehensively review the various land development codes. I didn't hear that talked about. This meeting felt like it was, I don't know, strategic. When we got to the place for everyone and the community plan to end homelessness, you're talking about hearing and you're saying all the right things. I like this one. This is page 14. You're saying all the right things there, and that's good. But when we get to the last few here, page 16, things are bad, worse than we thought. I appreciate that you guys are able to recognize that. Service providers are at their limits and you need more time to develop the plan. You need more money, it's risky. The last statement there that you aren't giving up, that's good, but we need to take the right steps. Service providers are at their limits because they're being stretched thin by a city that's expecting and not helping to provide. You need more time to develop the plan. I'm looking here that you're talking about discussing options until looks like almost December. It's going to be getting cold by then. And I'm wondering if I'm still going to be trespassed from being able to bring homeless people propane so they don't freeze to death this winter. You say we need to prioritize community engagement, education, and listening sessions, and you want to document your costs. And you talk about brave and strong leadership. You just about got there. Somebody at that meeting leaned toward it, but didn't quite get there. And I'm afraid that you have service providers that are afraid to tell you the harsh truths. They'll come talk to you about the things that you want to hear about that are negative, but the harsh truths don't come out. 20 seconds or so less. This is page 20. I've done a core request already to find out where the figures came from to get this. Comparing 222 individuals that ran up the highest hospital bills to the homeless people, that this isn't a homeless cohort. You have no calculation for what homeless was in this. This is part of a narrative, and it was wrong to bring it up.
Michael, do you mind signing in for us? Who else would like to be next? Yes, please.
Should I sign before I speak?
You can do it after.
Okay. So I've got this timed to 3 minutes exactly, but if I could just contextualize a bit, I really,
Can you give us your full name?
oh, I'm sorry, Kim
Thank you.
Grubbs. And I am just a citizen. I'm here representing myself. But just for context, and I appreciated a great deal listening for the last hour or so to hear you all sort of delve into and elaborate on the development of the plan and sort of the back and forth about what needs to be done. That was really helpful to kind of clarify what I see on paper, you know, in terms of Jill's update and in terms of the engagement sessions. Secondly, just for context, I'm retired, but I spent my career in emergency medicine. So I don't come to this naive. I've been all over this town, all over this county, in hospital. I spent part of my career as a hospital emergency department nurse and part as an instructor. So, I may be one of those people who you see as more oppositional, but it's not that I don't have some context or experience dealing with people who are in the worst, you know, in the worst circumstances of their lives. So with that in mind, homelessness is sad, and as are its causes, some outside the reach of the homeless person and others over which they have some measure of control. But we should all approach the homeless person with humility, recognizing there, but for the grace of God go I. And we, citizens of Lawrence and Douglas County, should strive to work together to address the challenge of caring for the person experiencing homelessness, while at the same time respecting the hard work and contributions of tax-paying citizens. The Homeless Plan's update is a place for everyone. How broad is our vision of everyone? Does Lawrence and Douglas County want to be known to the broader homeless community as a place where there's housing for everyone? Can scarce resources be stretched to accomplish such a goal? Regarding budget, caring for homeless is expensive, and taxpayers do not have an endless supply of money, particularly those of us on fixed incomes. There are some indications the tax burden upon citizens of Lawrence and Douglas County is approaching a tipping point, which will begin to push middle and lower middle class citizens to live elsewhere, and certainly make it increasingly difficult for those who are at risk for homelessness to remain independent. This is not what anyone wants. A $12.9 million annual cost of programming translates to about $14,000 per capita for the 668 homeless people served. And that's from page 16, Douglas County 2022 Homeless Needs Assessment. May I continue? Okay.
Would you be willing to send that to the commission?
Pardon me?
Would you be willing to send your writing? We have to hand it to Sarah. Yeah, thank
Okay.
you. And then I'll have you sign in while the next person steps up, but thank you.
I'm real sorry.
Okay.
There's certainly no shortage of time to allow someone to finish their thoughts, just saying. I've been to a couple of the public hearings, Michelle Eagleman Lawrence. And let me say, I don't know anyone who doesn't want to end homelessness. It's just that we differ on priorities and practical matters. If the city has funds to do something, let's do something that makes sense. Have you ever heard the expression, too many cooks spoil the soup? I know it's obvious, but it just means that a straightforward job is made much more complicated by many hands. And I would put forward that this plan is an example of too many stakeholders spoil the soup. Not too many people involved, but too many competing interests. Briefly, the plans that I've heard before today is like no plan I've ever seen. From the various stakeholders, we hear about rectifying historical disparities, realigning power imbalances, reparations, or we hear about affordable housing, non-discrimination in renting, seizing vacant structures, changing land development codes, and legal representation for the homeless. We hear about hiring consultants, full-time bureaucratic positions, as well as a token person with lived experience. We hear about decriminalizing homelessness, and significantly, there's no forecast of the cost of any plan past the point of the quick and juicy money, which is my favorite quote from stakeholder Leah. Listening to the presenters, one can almost forget the topics an individual homeless person. Can you tell me step one? How does this work? What qualifies as homeless? Do we serve everyone? Is a man different than a woman? What about people not from Douglas County? Do we have a bed? Do we have food? Who's in charge? Who decides what services are needed? Step two, where will the services happen? How will transportation work? What if services are rejected? Are there adequate caseworkers? What training is going to be offered and who's going to give it? What information gets tracked? What about recidivism? What role will law enforcement play? How are you going to address property damage, substance abuse, and mental illness? Illegal immigrants? Are these questions even allowed? Step three, are there stages? What are they? When does a homeless person graduate from one stage to the other? Are there expectations? What's level one? What's level two? Is there a time frame for people who can get off government assistance? If not, why? And what do we do to discourage and prevent homelessness? Are we creating incentives we shouldn't? Here are some brief thoughts that might be immediately considered and agreed on. One, people would agree that pallet houses in 2 locations are cost ineffective, whereas the current shelter location is ideal and could be used right away as a one-stop shop. Buses could get on board with better timed routes to and from the location where food and sanitation services are available. Office staff and bureaucracy are less effective than people on the ground, and staffing will be needed. Housing First is not a model that works. This plan is not a plan. It doesn't even seem to be focused on the individual. Each stakeholder has their own agenda.
Who else would like to come and give public comment?
My name is Emily Willis Stewart, and I'm not going to do as good of a job as talking as fast as some of these people. But I think that I have been attending a lot of these housing meetings and really trying to get a grasp on the homelessness issues. Every week we have been waking up at 5 o'clock in the morning and volunteering and doing Jubilee Cafe and trying to really figure out where things can get better and trying to do our part. As a property provider in Lawrence, I have done an extensive amount of research in regards to who is receiving the vouchers and who is about to receive the vouchers. And I think that it's interesting, when I went to the meeting yesterday, or I guess it was Monday night, I learned that they're voting on if they should be giving murderers, arsonists, and other criminals of different levels, and they had levels in their report. And I think that it's interesting because I heard you guys talk about the at-risk youth and aging out of foster care plan, but I want to make sure you guys are aware that there are 0 vouchers for children who have aged out of foster care. And we do know that and maybe that's different for supportive housing units, but for the actual vouchers of people who have aged out that do not require supportive housing, that may be able to just be successful on their own, there's 0. And I think that it could be really helpful if we put our focus on that and helped figure that out, because we know that these kids are going to be homeless. They have a 5% chance within 5 years of not being homeless. And if we could shift our focus and maybe try and do a little upstream and teaching of how to stay housed and what to do if you fall behind and who to ask for help. And how to manage those situations, and if that training could be required if you are an at-risk youth in Douglas County, if the Citizens Review Board and things like that could require that support to be in place ahead of time, it could really make a difference in our community. And that's kind of what I was thinking was important.
Thank you, and thanks for signing in. Who'd like to be next? If anybody else here in person who'd like to give general public comment? And do we have anyone online, Sarah? Okay.
Moving Sarah Hill Nelson into the panel. Sarah, you're in the panel. You can come off mute and provide your public comment.
Hi, my name is Sarah Hill Nelson, and I live in Lawrence, Kansas, and I just want to confirm that you all can hear me okay.
Yes, we
Okay,
can. Go ahead.
I also listened in on the work session and think I want to express my concern that I attended 2 of the different listening sessions. And when I looked at items that were listed as what we heard in listening sessions, I really felt like they were not representative of what I heard in the 2 sessions that I was in. And there are a long list of things that I heard in those listening sessions. And they came from a really broad variety of people. At my last session at the library, there was a person who had experienced this homelessness sitting at our table who expressed some of these same thoughts. So they're coming from a broad spectrum of people, but I'll limit it to 3 key items here. And one of the discussions that I heard over and over again in those listening sessions is that the concern that report does not address the really serious issues that we're facing with substance abuse. And it is a subtext, but in the original report, like housing is mentioned like 1,053 times and addiction is mentioned 9 times. And I say this without judgment. It's really important as a community. I believe we need to normalize and be non-judgmental and supportive in our open discussion about the very, very serious issues we have with meth and fentanyl in the community. And I think until we openly acknowledge and discuss those as a community, they're not going to be addressed. So I heard from many people across the community that they felt that the discussion of homeless substance abuse was not clearly and fully addressed in the report. And then 2, one of the key items that we heard was this question that's been raised earlier this evening, which is, we all really want to help. We are going to have a real and very serious discussion as a community about who we serve, because we cannot serve the world. And so that's going to be a painful discussion and a hard discussion, but we have to discuss like who is eligible for services. And then, and I heard that across both listening sessions, and that did not get reported in the report. And finally, I heard from several people that the report is a report. It doesn't provide a clear plan of action. And in particular, there's not an org chart for who's responsible. So those are 3 items I heard, and they were not included in your report.
Thank you, Sarah. And other Sarah, do we have anyone online? No. Okay. Second chance, anyone in the room for public comment? Okay, with that, I'll close public comment. We have no regular agenda items tonight, which is pretty rare. So we'll move on to appointments and commissioner or administrator miscellaneous.
Commissioners, I will be sending you an appointment for the Food Policy Council, so I will be looking forward to that in your inboxes.
Do you have any other report for us or commissioners? Do you
Yes.
have anything?
Commissioners, my memo, the weekly memo is attached. As you know, and I'm getting very close to publicly releasing the 2024 proposed budget. We are scheduled to be in budget hearings next Wednesday, Thursday, and Friday mornings from 9 to noon. So we'll be getting that information on our website and our calendar. The meeting's already been noticed and we're in the process of wrapping up that scheduling. So that will be a significant part of our work next week. To that end, at this point in time, as I'm working on the agenda for next Wednesday night, I currently don't have very many items. So unless I get something substantial, I will likely not cancel the 5:30 business session next Wednesday, July 5th. As commissioners know, we've not scheduled work sessions for the July 5th and July 12th because we will be in budget deliberations during the mornings. So I just want to give the public and the commissioners a heads up that unless something big comes in tomorrow morning, I am likely going to cancel the 5:30 meeting next Wednesday at 5, the 5th. And that's all I have, commissioners.
Okay. Commissioners, other commissioners, do you have anything for the good of the order?
This is Commissioner Reed. I just wanted to mention, because I don't know if either other commissioner might be there, but I'll be attending the Black 30 networking and mixer event this Friday evening. So didn't think to send that information to Robin, but thought I'd check with both of you to see if either of you RSVP'd too.
I did not. No.
Being there.
I don't have anything else.
Anything
Commissioner
from you,
Willie,
Commissioner Kelly?
I just have a quick question for Sarah about if we cancel on Wednesday next week. Sarah, is our thinking, would we think of maybe the July 5th meeting just being earlier and we would take public comment at our budget meeting, or just cancel it all together?
I mean, that's up to the commission. If you want to, I was trying to save you a trip back into the courthouse. If you want to notice that we will receive public comment at some point in time on that Wednesday, the 5th, we certainly can. I would notice, Commissioner Kelly, we generally for budget work sessions, we don't
Take
do
public-
formal minutes. And I wouldn't even have a consent agenda for you.
Okay.
So if you want to meet, we can certainly meet and have a quick meeting like we're doing right now. It's just, I was trying to save you a trip back into the courthouse.
I guess my thinking was we could still do a meeting earlier in the day, do a quick meeting earlier in the day and then get on with our budget session. But I'm not pressing for that. I just want to make sure that the public has an opportunity to speak with us if they need to.
I do have you booked pretty solid from 9 to noon that day. So we could stay late, but or we could come in early. But I already have hearings scheduled from 9 to noon. So
I don't mind staying late and being available for public comment if there's a way to get that word out. I do like getting a chance to hear from people during the budget cycle.
I do want to make it clear, you're going to have plenty of opportunities to do that. These are just the initial budget hearings. The final budget hearing is not till the end of August. And so we've got lots of opportunities between July 5th and August 30th for public comment.
This Commissioner Reed, I think based on the past couple of years, I, at least not off the top of my head, don't necessarily recall. I certainly recall some folks watching the meetings and having individual conversations with people during our hearings, not necessarily at our normal business meeting, public comment time, but my preference, if we feel it's important to preserve space for public comment next week, would be to, as Commissioner Kelly has suggested, well, I guess on the other end, like Sarah suggested, stay for just a little bit longer past noon if we feel like it's important to create space for that. So I guess I'm open and I would defer to chair and vice chair about preference on that.
Commissioner Kelly, since this idea began with you, do you have a recommendation?
Yeah, I think if we could, if other commissioners are open to it, we could do it like a work session. Because it is a work session, and then close it, and then at 12 o'clock, open it up, take any public comment. If Sarah has a consent agenda, we could knock that out real quick and then close it. Does that make sense, Sarah?
Commissioners, I'll do whatever you want. I'm a little nervous since it's not at the normal time.
Right.
You know, that we just making sure that the word gets out. It's up to you all.
Yeah, I mean, to me, it would be the same as, you know, the word gets out about canceling. So, I mean, we just have to let people know we're going to meet, we're actually rescheduling our meeting. It would be earlier if they wanted to provide. I just worry about, you know, I want to make sure folks have an opportunity to meet with the commission in person on a regular basis.
I would say if we decide to have a public comment opportunity at the end of our Wednesday budget hearing, I'm fine with that. As far as putting anything on a consent agenda, I think that makes it more difficult to make sure that people who might have wanted to pull that knew about it ahead of time. I think that part makes me uncomfortable.
So I'm afraid I've made things also more complicated, and maybe we should just meet at 5:30 and just have a regular full meeting and have a consent agenda and do like we're doing today. Because that way the community knows that this is when we normally meet, and just have you come back.
I am fine with that. That's what we're here for. I never mind the opportunity to take a Wednesday off if that is appropriate and if we don't have business that needs to be tended to. But commissioners, Commissioner Kelly, you began this conversation.
Yeah. Yeah, I don't want to waste staff's time, you know, and yet I don't think we're wasting time if we meet in person. I understand everybody coming in one more time. I guess I would lean to, you know, instead of canceling that meeting to having it at 5:30, even if it's short. That's just my preference, I suppose. I thought we could just tag public comment onto the end. I completely understand what you're saying, Commissioner Willie, about consent agenda items, and I think those could be pushed off 1 week until the next week. So maybe we could just do some public comment at the end of our budget session, and then close that out and call that the end of the meeting. I just want to make sure we're not setting the precedent. We've really never taken public comment at our work sessions, and that may set a new precedent for it.
And Commissioner, I'm also worried if we are meeting in regular business session to take public comment, I'm going to have to explain to the clerk why we don't want to approve accounts payable. So, you know, normally our normal business meetings include a consent agenda and public comment and those items. So I guess I'd just assume us not vary from, let's just stick to the game plan if that's what, if there's a desire to make sure we have opportunities for public comment. But I will remind commissioners, you are scheduled to take August 2nd off. Because that will be, there are 5 Wednesdays in August. So that is between now and the public hearing.
So Sarah, thank you for the offer. I think we will probably hold our regular 5:30 business meeting. Is that, do commissioners agree to that?
Agree.
Sounds good. Thank you.
Okay. And with that, do we have anything else? No. Okay, in that case, we are adjourned. Thank you, everyone.